Acute tubular necrosis, or ATN, is a common cause of acute kidney injury, particularly in hospitalized patients. Understanding its etiology, pathogenesis, clinical features, and management is crucial for medical students and professionals. ATN is primarily caused by two mechanisms: ischemic injury and nephrotoxic injury. Ischemic ATN occurs due to prolonged hypoperfusion of the kidneys, often seen in conditions like severe hypotension or shock. Nephrotoxic ADN, on the other hand, results from exposure to substances toxic to renal tubular cells, such as certain antibiotics, radiocontrast agents, and heavy metals. In ADN, the initial injury to the renal tubular cells leads to cell death and detachment from the basement membrane. This causes obstruction within the tubules and backleak of filtrate, reducing the kidney's ability to filter blood effectively. The subsequent inflammatory response exacerbates the damage, leading to decreased glomerular filtration rate. Patients with ADN typically present with signs of acute kidney injury, such as oliguria or anuria, and elevated serum creatinine. Additional symptoms may include fluid overload, electrolyte imbalances, and uremic symptoms like nausea, vomiting, and confusion. Diagnosis of ADN involves a combination of clinical assessment and laboratory investigations. Key findings include elevated blood urea nitrogen, BUN, and serum creatinine levels, along with abnormal urine analysis showing granular casts and renal tubular epithelial cells. Imaging studies and renal biopsy may be employed in complex cases to confirm the diagnosis. Management of ADN focuses on addressing the underlying cause and providing supportive care. This includes ensuring adequate hydration, correcting electrolyte imbalances, and avoiding further nephrotoxic insults. In severe cases, renal replacement therapy, such as dialysis, may be necessary. Preventive measures, such as optimizing hemodynamic status and using nephrotoxic drugs judiciously, are also critical. To recap, acute tubular necrosis is a major cause of acute kidney injury characterized by ischemic or nephrotoxic injury to the renal tubules. It presents with oliguria, elevated creatinine, and electrolyte disturbances. Diagnosis is made through clinical and laboratory evaluation, and management involves supportive care and addressing the underlying cause.